Good afternoon. So today we have a few important updates on schools, child care, and the launch of the state's pandemic unemployment assistance program. And we'll also provide a quick update on testing and hospitalizations related to COVID-19. Before I get into that, I want to address what I think is on everybody's mind, which is when does new normal get here? Right now, the Commonwealth is still in the surge. And while we're seeing fewer positive cases per day, more and more COVID-19 patients are being admitted to our hospitals. Our healthcare system is keeping up, thanks in large part to a ton of planning and your efforts to stay home, socially distance, cover your face in public, and work remotely. But the data shows we're still very much in the grips of a pandemic here in Massachusetts. Now, I know that's hard to hear and it's hard for me to say. But there are many unknowns about COVID-19, and our healthcare experts and epidemiologists are learning more every day. But what we do know is that there's no cure, there's no vaccine, and that COVID-19 is an insidious and at times invisible virus. The facts on the ground tell us that we need to stay strong, continue to socially distance, and stay home. While we ask for your full cooperation to get this job done, please know that we're working hard to think about a strategy to reopen the economy. We'll have much more to say about this in the days ahead as we pull together the best and brightest minds from our business and public health and academic communities to work together to put together a thoughtful framework that can work in Massachusetts. I think we all want to move on from this. Believe me. But I think it's really important for people to understand what's at stake. I can't wait to see my 91-year-old dad again, but I don't want to see him unless the circumstances and the situations and the rules of engagement are right, and that the data, the prerequisites about what's actually going on the ground here in Massachusetts support that kind of thing. Doing it wrong could create more hardship for everyone in the long run, and we're going to do everything we can to avoid that. So right now, people need to dig deep and stay put. Please only go out when you need to, and wear a mask or cover your face in public, especially if you're in a position where you won't be able to physically distance. We are all in this together, Massachusetts, and we will come out the other side of it stronger than ever. With respect to testing, yesterday the Commonwealth conducted 7,157 new tests. That brings us to a total of around 169,000 tests. The state reported 1,566 new cases of COVID-19. The last few days we have seen fewer positive cases day to day, but it's too soon to draw a conclusion from that data. First, a few days does not represent a trend. We've said that many times. And we have seen the data bounce around over the course of more than a few days. Second, the number of positive tests is entirely dependent on who gets tested. And what I mean by that is the daily test totals don't represent necessarily what's happening across the entire Commonwealth. For example, we've prioritized testing for nursing homes and hotspots, which obviously affects the number of positive tests we get when we test. One piece of data that we watch very closely is the number of hospitalizations for COVID-19, and we are still seeing an increase here. On personal protective equipment, we were pleased to receive 400 ventilators from New York on loan. We reached out to Governor Cuomo's office in New York last week. They're on the other side of the surge, and they were kind enough to lend Massachusetts this life-saving equipment during our surge, and for that, we are enormously grateful. As of yesterday, we've delivered over 5 million pieces of personal protective equipment, and our command center is communicating daily with hospitals and medical professionals around the Commonwealth to monitor the capacity of our hospitals. As of the end of the day yesterday, there were approximately 18,100 available beds statewide. Approximately 3,800 beds are occupied for patients with COVID-19. About 10,300 beds, or about 53% of our beds, 58% of our beds overall, remain unoccupied and available for patients. Those empty beds include about 6,800 acute care and non-ICU beds, approximately 2,600 ICU beds, and 900 beds at our field medical hospitals, although we do anticipate that hospitalization rates may increase in the coming days. As I've said before, this is an insidious virus, and it puts our doctors, our nurses, and our other frontline medical staff to the test. But thankfully, we have some of the greatest healthcare providers in the world here, and we have all worked enormously hard to prepare for this. Many hospitals have reported a reduction in patients seeking care for other serious medical conditions like heart problems and cancer treatments and kidney dialysis. It's important to remind the public that our hospitals have made accommodations for COVID-19 to ensure that they can also care for other healthcare problems. People should still call their doctor to talk about their own health and their own health care and go to the hospital if they have an emergency. We worked hard to set up a telehealth program for people so that they could more easily connect with their healthcare provider, and many people are doing that. And Buoy.com, which is a Massachusetts-based company that gives people the opportunity to diagnose online using their artificial intelligence tools, have actually served at this point over 90,000 people. And there have been people in cases where they've worked through the system where their recommendation has been to call 911 and to go get the health care that they need. Please, use the system. We worked really hard to make sure that it would be there for you if you had an issue or a problem that had nothing to do with COVID-19. If you don't feel well, please contact your clinicians, engage, and be involved in making sure that your health care needs are taken care of. Call 911 in an emergency and get to a hospital if you need immediate medical help. We don't want people getting sicker or exacerbating an illness or an injury because they have concerns about the healthcare system's ability to meet their needs. Folks are there. Folks want to serve. That's what all this preparation was all about.